So, good morning, I'm Ruben Nogueiras. I work at the University of Santiago de Compostela in Spain, and I will be talking about the new treatments for obesity. Well, there is currently a revolution in the treatment of obesity, and in 2025, at the end of this year, it is supposed to be approved a new drug. It is a dual agonist, so it is a GLP-1, which is an intestinal hormone, plus a GIP, another intestinal hormone. So this molecule puts together these two hormones, and this drug has been approved for the treatment of type 2 diabetes, and it is supposed to be approved very soon for the treatment of obesity. And on the top of that, we have new drugs and more clinical trials that are supposed to give some beneficial results to patients with obesity. Historically, obesity has been a risk factor for other diseases like cardiovascular diseases or type 2 diabetes. Nowadays, we assume that obesity is a real chronic disease. So, in addition to that, I must say that the classification has evolved because in the past, the body mass index was the only one factor to take into account. But now there are other aspects that are being considered, and one very important is how the excess of adipose tissue may affect to the function of other organs. So right now we can classify obesity in preclinical obesity if the excess of adipose tissue does not affect to the function of other organs, or clinical obesity when the excess of fat mass affects further organs. We must think that obesity is a multifactorial disease. This means that for the treatment, it should be considered as a work from multidisciplinary areas. And of course, a nephrologist should be one of those experts in this network, because it is impossible to treat obesity efficiently only if one particular area of experts are involved in the decisions. To improve the collaboration, I will say that it will be important, one, to integrate nephrologists in the discussion of patients with obesity, how the treatment should be, the doses, and so on. And second, probably it will be important to improve the training of nephrologists for allowing them to have the information on the new treatments and how are they working in real life. So yeah, there are some studies indicating that these new drugs are efficient for chronic kidney diseases. Actually, it has been reported that they ameliorate the progression of kidney diseases. And actually this year, in 2025, one of the drugs, semaglutide, has been approved for the treatment of chronic kidney diseases and type 2 diabetes. So patients who have these two diseases can be treated with this drug, and apparently, according to the clinical trials, the drug is working quite well. Yeah, as I said in the beginning, there are new drugs coming. Actually, there are new clinical trials coming on every week, I would say. And some of the drugs apparently can improve to the current drugs that have been approved by the FDA for the treatment of obesity. So I think that we can be optimistic in this way, and this new generation of drugs putting together 2 or even 3 different hormones in the same molecule can have a superior effect to the current drugs.